everyone. Thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Last week, we talked about the increasing case numbers in Europe that I felt were a direct consequence of the more transmissible BA.2 subvariant of Omicron. Here's a blown-up graph of the countries that looked like they were struggling last week, and you can see that several are leveling off or coming down, which is good news. Here in the US, all indicators are still good except for rising wastewater levels. When I look at the Massachusetts wastewater, specifically Deer Island, which processes waste for the Boston metro area, I still see a really gradual uptick in the south system and a little bit in the north system too. It's important to mention that when the wastewater increased due to Omicron, it wasn't gradual like this, it was rapid. Because I like to highlight reassuring things, I'll point out two new developments over the past week. The first is that CDC found a coding error that removed over 72,000 deaths from its tally and, importantly, decreased the number of pediatric deaths by 416, dropping at 24% to 1,341. Still way too high, but better. The other is a CDC report on flu versus COVID hospitalizations in children. Their analysis was that flu-associated hospitalizations in the 3 years prior to the pandemic for children younger than 12 were similar to or higher than COVID hospitalizations, whereas for adolescents, COVID hospitalizations were higher than flu. So there are two ways to look at that information. One way would be to say that we could take similar precautions with children under 12 in the setting of the pandemic as we do during a usual flu season, which for most families means very few precautions, and those children under 12 would not be at greater danger than they were prior to the pandemic. The other way to look at it is that we perhaps should have been taking more precautions during flu seasons in the past. And of course, we can't discount that long COVID can occur in children who get COVID and are not hospitalized, but thankfully, long COVID is quite rare in kids when looked at in well-done studies. Our first question is from Louise in Abington. How concerned should we be that Congress has so far refused to authorize additional funds for boosters and testing to help prepare for additional COVID surges and variants? Pretending the pandemic is over will not make it so. Well, I'm definitely worried. As you know, the CDC endorsed a policy shift away from counting cases to focusing on hospitalizations and shifting responsibility for mitigation measures like masking to individual choice. But as you said, that doesn't mean the pandemic is over. It doesn't mean we don't need to work harder than ever to keep people out of the hospital. And if anything, shifting away from mandates and rules means that the onus is on governments and healthcare systems to do what's most important to maintain the health of the community, and those things cost money. Things like vaccination and boosters, including and especially for those who have no insurance. Things like making sure we never run out of testing capacity during a surge again, and that tests are free for everyone, and that people can get results fast enough and access to treatment early enough that the treatment will be effective. Things like paid sick leave, medical grade masks for those who need them, and educational initiatives so that people know how to access services. I really hope that the current and future pandemics get the funding they desperately need. Our next question comes from Marlon from Wayland. Much has been made of the stealth Omicron subvariant outbreaks in Europe and Asia, and it seems that we will see some level of uptick in cases here. What is the general thought on the timeline and likely severity of this spike? I showed you the shapes of the curves in Europe a few minutes ago. Those are countries that had already had an Omicron surge and are now experiencing double peaks or upticks. In Asia and some other places like New Zealand, they're just seeing their first Omicron surge now. So what happens there is less relevant to predicting what may happen here. We have a lot of immunity here from our Omicron surge. My hope is that we'll be protected by our combination of vaccination and previous infection, including an estimated 40+% Omicron infection, which those countries do not have. The CDC's updated estimate is that the US is at 34.9% BA2, the Omicron subvariant, while the New England region is now at 55.4%. To be able to get to that high of a proportion without a huge increase in wastewater levels or cases is a good sign. I'm hopeful for only a bump in cases and hospitalizations over the next few weeks rather than a spike or a surge. Felicia from West Roxbury asks, if I were to develop COVID-19 today, how do I know if I qualify or should receive one of the available treatments, and how do I access those treatments? Chances are extremely good that you do qualify. That's because the CDC's list of risk factors for severe COVID is long, and there are things on there you might not expect. Certainly things like cancer and chronic kidney, liver, heart, or lung diseases, but also being overweight with a body mass index as low as 25, being physically inactive, having a learning disability or attention deficit disorder, or having a substance use disorder. Check the CDC website, and if you qualify, it's really important that you get a test as soon as you have any symptoms that could be consistent with COVID. Cough, sore throat, nasal congestion, fever, etc. If you strongly suspect COVID but have a negative at-home test, consider getting a PCR test because it can take a few days for the home tests to turn positive once symptoms develop. And it's really important that you reach out to your doctor to get treatment early. Some of the treatments can't be given more than 5 days after symptoms begin. We have 5 options for treating Omicron right now. 2 pills, Paxlovid and Molnupiravir, 2 monoclonal antibodies, bebtelovimab and sotrovimab, although we're watching the latter to make sure it works well against BA2, and a 3-day infusion of intravenous remdesivir, which is an antiviral. There's plenty of them to go around, plenty. If you live in Massachusetts, you can go to the Massachusetts COVID Therapeutics Locator website to find all of the pharmacies that have the pills and all of the infusion sites for the intravenous options. That's all the time we have for this week. You can send me your questions about the rollback of COVID restrictions, how spikes elsewhere may impact us in the weeks to come, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.